Hi, I'm Michelle De La Rosa, physical therapist at Connect PT. If you scour the internet for different treatments for pelvic pain, specifically pelvic floor dysfunction, like pelvic floor spasms, tightness, restriction, you'll often find things like breathing, stretching, meditation, and relaxation techniques to help lengthen and relax the whole pelvic area, all of which we support at Connect PT. Oftentimes our patients engage in those treatment techniques, feel better, their symptoms are calming down, and they're wondering, how can we start strengthening our core? How can we become more aggressive about exercise? So here at Connect, we do teach simple exercises to strengthen our deep abdomen, our deep low back, so we can take the pressure away from those pelvic muscles that people work so hard to relax. So I'd like to show you some easy exercises to start strengthening your core. So the first exercise that we're going to do is called a heel slide. A heel slide is done lying down. You can slide your leg away. Go ahead, slide one leg. Good, nice and slow and calm, and the other leg. And the whole time we're looking at what's happening in the pelvis. It's important that your lower abdominal muscles are tightening, so you just want to feel like they're flattening very gently versus feeling like really tight and really sucked in. You want to feel like a gentle flattening, as if you're making the shushing sound. Shh. As you're doing the heel slide, you want to see that your pelvis is not moving a whole lot because you're using your lower abdominal muscles. So it's not shifting this way or tilting, but staying fairly neutral. If you're able to do 10 or 15 of these and it's not very challenging, you can move to marching. Marching involves just picking up your foot. So you're about here and then slowly coming back down, and then the other side. So you're still alternating, but it's important again that your lower abdominal muscles are active. I'm looking at shifting. I'm looking at tilting. Basically, if you are shifting too much, if you are tilting back and forth, or if you feel your back muscles, it's not correct. You want to really feel this lower abdominal area, and for sure you don't want to feel any reproduction of any symptoms. So that's kind of one grouping of an exercise. Another exercise you can do is bridging. Bridging is an extension of really pelvic tilt, which I'll demonstrate here. So all you have to do is tighten your lower abdominal muscles and roll very slowly into a pelvic tilt, and lifting up with your glute muscles, not your back, and slowly rolling down. Good. And slowly rolling down, still breathing. Again, it's really important that you're not arching your back, feeling your back. All of it is really in your abdomen, stabilizing, and it shouldn't feel any reproduction of symptoms. Mostly feeling your lower abdomen and your glute muscles. Perfect. Work your way up to doing 10 or 15 of these very slowly and very controlled. Great. Third exercise, you're going to turn onto your side. So you can turn onto your side. Okay, we're going to do a clamshell. A clamshell is where your feet are together and your hips have to be stacked. Okay, you don't want to really roll back too far back or too far forward. You really want to stay with one hip on top of the other. You're going to keep your feet together and you're going to lift your knee up slowly. Good. And you're going to lift until you feel that the muscle on top of your hip in your glute is contracting or working. Again, you want to keep your lower abdominals tight, very gently contracted, just to stabilize yourself and protect your back. And you're going to feel the top of your hip working. There's very little pressure on your feet, and you should just feel that top hip working. And breathing. The whole time should be breathing. Again, work to about 10 or 15 of those, and no reproduction in symptoms. Great. The fourth exercise we'll do is called a reverse clamshell. So a reverse clamshell is the reverse of what we just did. So you'll put a little towel in between the knees. Again, your hips are stacked, but instead of lifting the knee, you'll lift the foot. Okay, so you'll lift the foot up. Again, you're going to feel the muscle on the top working. Keep the lower abdominals tight. No reproduction of symptoms, no back pain. Everything is in this area on the top of your hip and the lower abdominals. Keep it nice and controlled, slow. Keep the feet aligned also. Sometimes we'll see people bending this way. Let's really keep it right above the other foot. Great. If these exercises, the ones we've done so far, are very doable, you can try exercise 5, where take the towel out and you're actually going to straighten the top leg. So go ahead and straighten it out. Good. It's really important that you stay stacked in your hips, and you're going to lift the whole leg up instead of keeping it bent. It's a leg lift on the side. So be really careful about rolling back, which might mean that the exercise is too hard for you. So if that's the case, you might have to wait to do it, okay? Also, you want to make sure that your leg is really in line with your trunk. So you actually have to bring your leg back a little bit. This is a very, very common technique that we have to adjust for people. So again, feel on the top of your hip. Feel your lower abdominals tightening. Good. And I'm mentioning the name of these muscles because if you feel the exercise in a different place, it is usually not correct. Good job. Okay. For the last exercise, this is going to be on all fours, so on hands and knees. So you can flip over onto your hands and knees. So this is a nice position because we're looking at using more of the whole body. Okay, so you want your arms and your shoulders to be matching up, hands to shoulders, knees to hips. You want to make sure you're in neutral, so you want to pick this up a little bit. Neutral means level in your spine. Okay, level in your spine. Pick your head up just a little bit. Perfect, good. You should feel by putting yourself in neutral that your lower abdominals are tightening a little bit. Okay. Nothing should be too hard. You don't want to flare your symptoms. In this position, just feel your breathing. Make sure you feel your ribs can expand and come back together. Make sure you have the ability to tighten your lower abdomen, that you can feel the lower abdominal muscles working. And feel comfortable with that. Once that's in place, you can start challenging yourself. You're going to lift one arm while you keep everything nice and tight and slowly come back down. And then the other side. And the challenge here is, let's keep everything level. Let's keep our shoulders level. Let's keep our hips level. Perfect. Good. If you start swaying, moving around, you may have to lift your arm less and modify. Scoot forward a little bit so your legs have more room when you do the leg part. So the other part that you can move is your legs. Again, you want to keep your pelvis in neutral, so pick this up a little bit. Good. Always readjust yourself after you've done one section. Do you have enough room? Maybe slide forward a little bit more. Yeah, perfect. So you're going to slide one leg away from you and keep your toe on the ground. Yeah, good. Really look at, is that altering my pelvic position? So you're going to fix that there. Good. Slowly come back in and then do your other side. Keep your lower abs tight and breathe. I can't see it's breathing, but breathe. Okay, slowly come back in. Where will I feel this? Glutes and abs. Okay. Readjust if you need to. Perfect. So these are simple exercises that people can start doing if they want to work their hips, their core. Any more questions, please contact us at Connect PT or your local pelvic physical therapist. Thanks so much.